Good morning, everybody. I want to welcome you to the final session of our four-part webinar series. Our presenter for this session is Emily Henderson, a government affairs consultant at McCall, Hamilton Advocacy and Public Affairs here in Lansing, Michigan. And she is the ARC Michigan's dedicated lobbyist. Emily regularly updates us on governmental affairs and is an expert in state legislative and regulatory health and human services issues. Today, Emily will talk about Michigan's political landscape, provide an advocacy update on key issues that the ARC Michigan is following, and share tips on effective advocacy and connecting with your legislators. If you want regular updates from Emily, you can get them by signing up for our newsletters, and Courtney, I believe, will put that in the chat, the sign up link. Thank you. Take it away, Emily.
Good morning, everyone. Thank you all for joining today. As Sherry just introduced me, my name is Emily Henderson, Government Affairs Consultant at McCall Hamilton. We are operating and located in downtown Lansing, and we follow all the things happening with our state government on the legislative side, so our Capitol and our governor's office, as well as our regulatory side with our different departments. So earlier today, you heard from some of our professionals that we regularly are in contact with. So I'll get into all that later in my presentation. But this time around, I'm giving a similar presentation to what I did last year, but obviously things have changed as it has been a full calendar year. So lots of updates to share with everyone. And if there are questions, feel free to ask them. I'll try to answer them as I'm moving along, but happy to do more of a Q&A period at the end of this as well. All right, so like I mentioned, we'll be talking about what's happening in Lansing. And then after I kind of give you all an overview of how operations work in Lansing, with our state, I will get into how to be an effective advocate and hope that I can share some knowledge with all of you on how to be the best advocate for yourself and then for your organizations. So first, I will start with an overview of Michigan's current landscape. So this includes our executive and our legislative branches. In our executive branch, we have our Governor, Gretchen Whitmer. She is serving her final term as governor. She won her re-election last election cycle in 2022. And so she is still leading our state in that executive office role. And she is also overseeing our different key state departments and agencies. So quick list of some agencies that the ARC regularly works with. We have our Department of Health and Human Services. That includes Behavioral, Physical Health, and Aging Services Administration, or BPHASA. We have our Medical Services Administration, which is Medicaid. And we also have our Bureau of Children's Coordinated Health Policy and Supports. So all of those, that's not the exhaustive list of the areas that we get involved in on the regulatory side of things, but those are some of the key areas that we focus in our advocacy. And then we also work with our Department of Education in Lansing as well. So looking at those state departments under the purview of Governor Gretchen Whitmer and her team, we have our state agency leaders. So this largely focuses on the Department of Health and Human Services. Our department is led by Director Elizabeth Hertel. And then underneath her, we have Chief Deputy for Administration, David Knesik, our Chief Medical Executive, Dr. Natasha Bagdasarian. And then some familiar names I'm sure a lot of you are familiar with. We have our Senior Deputy Director of BPHASA, Megan Groen. We have Director Demetrius Starling of the Children's Services Administration, Kristen Jordan of our Specialty Behavioral Health Services, Patricia Neatman, Bureau of Children's Coordinated Health Policy and Supports, Belinda Hawks, Division of Adult Home and Community-Based Services. And then to tie it all up, the individual that links our state departments to our legislative body is Director of Legislative Affairs, Sharday Burton. So these are some key names. Like I said, not an exhaustive list, but some of these may be familiar to you if you're involved in advocacy, involved in receiving reports from the ARC. These names will likely pop up pretty frequently. So now that I covered our executive branch and our state departments, I'm going to get into our legislative breakdown, which is the piece that is one of the most important pieces to advocacy on the state level. So to give you an overview of where Michigan falls with the rest of the country, so we are that dark green full-time legislature. So what that means is that we operate year-round. Some of the other states, as you can see on the map, are part-time. If you look at the northern, middle, central part of our country, they're only operating a couple months out of the year. Our states that are hybrid, they also operate in a similar way. So, you look at Texas, for example, is one of the gray states. They are operating for about 4 to 6 months out of the year, and then the other half of the year they might be doing some hybrid work, but they also have other jobs. And so anyone who also falls in that yellow category, their legislators often are legislators part-time, and then they have their own careers outside of being an elected official in the state. So Michigan is unique in the fact that our legislators, their full-time job is legislating. I'll get into this later, but if they're not in Lansing working on legislation, they are on the campaign trail. We obviously have designated breaks built into our legislative calendar. We have the holiday season in December to January. We have the summer months, like I said, for campaigning or a summer break. Then we have a couple weeks throughout the year that our legislators take time off. But they are full-time operations, so they are so lucky to hear from individuals like myself and other advocates in the Lansing area, 12 months out of the year. So getting into some details on our state legislature. And a lot of this information was shared last year if you joined and were able to see that presentation. We are still in the democratically controlled House, Senate, and governor's office. So this is the first time in over 40 years that we have a Democratic trifecta. So what that looks like, we have 20 Dems in the Senate, 18 Republicans in the Senate, and in the House, we have 56 Dems and then 54 Republicans. So we have a 2-seat majority in each chamber. The Senate are larger districts, so we have less seats across the state. This is considered the upper chamber or the senior chamber. A lot of times we see House members, they start off in the House with all 110 people and they move over to the Senate where there's only 38, as they move through their career in the legislature. So our leadership is still the same as it was last year. Michigan operates in 2-year legislative cycles. So 2023 was the start of the first year of the legislative cycle. And then now that we're in 2024, this is the second year of that 2-year legislative cycle, seeing that we have elections happening at the end of this year. So depending on what happens in those elections, this makeup might look a little bit different. I'll get into that in a couple slides. But our leadership is still the same. So Senator Winnie Brinks from the Grand Rapids area is still our Senate Majority Leader. And then House Speaker Joe Tate out of the Grosse Pointe, Detroit area is still our Speaker of the House. Some notable changes this year compared to last year. Last year was the first year of this Democratic trifecta, very fast-paced environment. Democrats had a lot of priorities, some that the ARC was following that had been sitting on the back burner for decades, not having the opportunity to have Democrats holding all points of office in the state legislature. So what we saw last year was we had 2 House members who actually left their seats because they won their elections for mayor in their local districts. That is former Representative Lori Stone from Warren and former Representative Kevin Coleman out of Westland. They won their fall elections. And so we actually had, up until April of this year, a 54-54 split in the House between Democrats and Republicans. So that changed the cadence pretty quickly in Lansing without having that 2-seat majority for the Democrats. We saw a quieter policy year. Doesn't mean work wasn't being done. We are waiting, state was waiting in anticipation for those 2 House seats to be filled by a special election. And then we did see the Dems regain that 2-seat majority as 2 Democrats filled those 2 vacant seats that were left by 2 Democrats. So our new representatives are Representative My Song out of Warren and then Representative Peter Herzberg out of Westland. So if you have not met your new legislators and they happen to be one of these 2 individuals, absolutely make a point to reach out to them. They're still getting, their feet wet in the policy arena. They recently were assigned to new committees, and so they are working through a legislative process, and as of right now, turning that around and starting to rerun for election again this fall. So they definitely have a short stint here in Lansing, But because it has been pretty busy the past couple weeks since they were brought in, we expect to see that work continue throughout the rest of this year. So I wanted to break down some of the policy initiatives we've seen this legislative cycle between our Democrats and Republicans. This is not exhaustive. This is a very brief overview. So I think if I had an exhaustive list, this would be slides long. So I tried to condense it to some big picture items for all of you to see today. So a lot of the things that the Democrats wanted to work on got done last year before those two Democrats left their seats. So that is why we had a very busy, fast-paced first 6 months of the year in 2023. Democrats focus on healthcare, gun reform, voting rights and accessibility, education reform, and housing. They are still working on a few of these. We still have voting rights and accessibility packages out there. There's still healthcare packages moving. Education reform is a big piece. That's a hot topic right now. And then housing is still something that our legislators are actively working on getting done before the end of this year. So lots of other items fall into this list. I'll get into some specifics in a future slide. But to kind of show you the difference between what Democrats are focused on and then what Republicans would like to focus on, should they have had majority, definitely some stark differences there. Looking at the Republican side, we have reducing state income tax, restoring right to work. Unionization efforts was a big piece of the Democrats' agenda last year. So Republicans will be focused on, if they win elections, what could they potentially change that was passed by Democrats this past year. Small business supports, and then increasing accountability over taxpayer-funded economic development projects. This with education is a big piece and a hot topic right now in Lansing. So we will see how that develops in the next week here and over the summer. But, looking at these two lists, like I said, Democrats have a trifecta for the first time in 40 years. So some of these issues, they've always been talked about, but maybe some policy hasn't been getting done in areas that advocates and legislators would like to see. And when you look at the Republican side of, their initiatives, they have had control of the House or Senate or governor's office much more often and frequently than the Democrats. And so their list is definitely more narrowed and more specific. Democrats had some sweeping reforms they wanted to make when they won all of their elections at the end of 2022. So quick overview. Obviously, things are subject to change the rest of this year, but I wanted to break down some of the differences that we have seen the past legislative cycle. So as we continue policy work in Lansing, we have an election year. So I mentioned we were in that 2-year cycle. It is 2024. We are in that second year of the 2-year session. So we have an election coming up this fall. I want to make note of some of these dates for you as you continue your advocacy or want to get involved in advocacy. Just know that we are slowly entering campaign season. We have a primary coming up on August 6th. So right now, out of all 110 House members who are running for their seats, 35 current House members will have a primary challenger. So that means if they're a sitting Democrat, another Democrat is challenging them to the August 6th primary. They're a Republican, they have another Republican challenging them to the August 6th primary. So we will be closely watching how those primaries shake out. Will we have any current incumbents, so legislators that are currently holding their seat, lose that primary election, or will they be a shoo-in, going into the fall? So we'll keep an eye out for that race. Especially some of our members that we work closely with. And then on November 5th, we have that general election. So that is the big election. You have a Republican versus your Democrat, and we will really see who wins their race and who will be the incoming legislator in 2025. Some things to watch. Redistricting, that is one item that we are watching very closely this summer. And then also term limits. I shared this in last year's presentation, but we had a ballot proposal that was adopted by the majority of citizens and residents in the state of Michigan, which changed term limits to a total of 12 years over either in the House or the Senate, instead of a certain number of years in the House and then a certain number of years in the Senate. So we're closely watching which legislators are hitting that 12-year mark, or which legislators have decided to not run for the House this year in anticipation for the Senate race that will be coming up 2 years from now. So I briefly mentioned redistricting. And I won't read all this verbatim. Lots of news articles have been out there and reported on regarding redistricting, but in early 2023, there's a challenge by some Metro Detroiters who argued that our Michigan Independent Citizens Redistricting Commission improperly used racial data in drawing the new maps. So every 10 years, when we have a consensus, each state has to draw new lines for legislative districts. That is what happened. And then there was the lawsuit that said that some of the racial data was used incorrectly. What we generally saw was that in the 2022 elections, a majority of the maps in the Metro Detroit area split up the city of Detroit into more so like bowling alley lanes from the city of Detroit out into the metro areas. For those of you familiar with that area of the state, city of Detroit is a predominantly Black community, Black city, and our metro areas are more white. So they saw, the ones that ended up winning their suit saw that the city of Detroit, the Black vote was diminished because it was grouped into these majority white neighborhoods. So what that meant was this past year, our Citizens Redistricting Commission has been creating new maps based on the court ruling that found that the racial data was incorrectly used. So we did see some House maps change. Those maps have already been adopted. Our two new representatives had to run in those new districts just a couple weeks before their special election. And then they are currently working through a Senate map, which we expect to see finalized by the end of this summer. So, we're keeping an eye out for what that looks like for the Senate. Early data shows that it still does give an edge to Democrats in both the House and the Senate. And so I think there's an increased possibility of the House Democrats keeping their majority this fall. I don't try to make predictions on elections though, because anything can happen. But the data does show that Democrats do have a little bit of an edge, as they did in the last maps as well. So for those of you who are familiar with your legislators, if you recognize any of these names, definitely keep an eye out for the races. If you are supporting any of these individuals, I'm sure they would love to use the help knocking doors and getting, getting the vote out. So our House districts that we watched and that changed, on the left, we have those, like I said, those House districts that I just talked about. And then we are keeping an eye on the following Senate districts on the right side. There are 8 different maps. This is kind of a general overview. There are some other districts that may see changes, one of them being Senator Kevin Hertel's. So that's another one we're keeping an eye out for. But wanted to give you all an overview generally of the areas of the state which have been affected by redistricting. And if you fall into any of these districts or recognize any of these names, these are the races to watch out for. All right. That was my legislative update, quickly giving you all an overview of, the breakdown of Lansing, what it looks like. I'm now going to get into some nitty-gritty details on our state budget. We are in the height of budget season. We are actually supposed to wrap up by July 1st. So I think we're all keeping our fingers crossed here that happens before the July 4th holiday. But, my goal here is to give you all a good overview of our budget timeline and when is the best time to get involved in the budget in Lansing. So this chart and some other materials will be linked on the ARC's webpage along with my presentation. So you can always refer back to this. But I wanted to provide you all with an overview of what our state budget process looks like. I did not make this. This is from the Senate Fiscal Agency, which is a wonderful resource for those of you who would like to learn more about our budget. But we are currently in this red bar under June. So we are looking at our budget targets being negotiated and we're wrapping up the budget. That's really where we are right now. But our fiscal year, so we don't run on calendar years. Our fiscal year starts October 1 and then that fiscal year runs through September 30th. So we are currently in fiscal year 24. That fiscal year started October 1 of 2023. And the current fiscal year will end September 30th. So we operate in single year budgets, which means that we are technically doing budget negotiations and conversations all year round, just based on the fact that we kick off budget conversations in January. So looking at what kind of the breakdown is here in Lansing. January, we have our governor deliver her state of the state. That's where she or he talks about their big priorities, what they'd like to see get done legislatively, what they would like to fund down the road. This is kind of the big ceremonial event to the start of the year. In February, we see the governor's budget recommendations delivered, and this follows what is called the Consensus Revenue Estimating Conference. So typically in January, we have that conference, and that sets the governor up and the state budget office up for presenting their recommendations. So, following the state of the state, typically the governor takes whatever actions were laid out in that speech, puts it into a budget. And this is really just conceptually what the governor, if he or she got to create a budget for the state, this is what they'd like to see. So last year, we saw a lot of things from the governor's proposal carry over into the House and Senate recommendations. And that's because we had a Democratic trifecta. So we had a lot of members on the same wavelength. In the previous legislative session, when we had Republican House and Senate and Governor Gretchen Whitmer was serving her first term, lots of differences had to be negotiated out between what she had recommended and then what our Republican House and Senate recommended. So we really get started in January with that CREC. And then February, the governor delivers, their ideal budget. And then March, April, and May, so this yellow block here on the middle left-hand side of the screen, this is really where advocacy takes place. So if you are looking to be involved in asking for state dollars to fund something, or ask that our legislators continue funding a program that currently exists, this is the time to get in the door with your legislator, to go to coffee hours, to get in contact with them, because they will be working through these 3 months to create their budget recommendations on both the House and the Senate side. So we have passed that threshold at this point. In June, we see it start to get narrowed down very quickly. So we have what are called conference committees created. This is where we have a few senators and a few representatives. They come together, they look at each of their recommendations from their own chambers, and they literally go through budgets line by line by line, dollar by dollar, and they start crafting their budget based on the May Consensus Revenue Estimating Conference. So in May, we get updated state revenues, updated tax dollars collected, and that leads the legislature to finalize those numbers in boilerplate language as we move through the process. So that's where we currently are. We have a July 1st deadline of getting the budget done in the state. And that gives the governor the summer months up until September 30th to sign that final budget. So really our legislature, takes control of the budget. They're the ones that dictate where dollars are being spent. And so that's why it's so important through March, April, and May to meet with your legislators, educate them, and find those advocates who will bring your issue to the table at the end of the day to be included in the budget. So, with that July 1 deadline approaching quickly, we are expecting budget conversations to wrap up, fingers crossed, this next week as we approach that July 1st deadline. In previous years, especially during the COVID-19 pandemic, we did see our legislature extend that deadline throughout the summer. That is a possibility this year. However, as I mentioned earlier, it is an election year. And so we have 110 House members who are eager to get work done so they can take the summer off to hammer out knocking doors, sending flyers, and running for office. So hopefully, if we get a budget passed by July 1, the governor will have the summer to evaluate those bills. She is only able to line item veto. What that means is she cannot go in and change numbers and change words. She can look at the budget itself and she can cross out lines of language or items that were funded. So, like I said, it's really on to the legislature to pass a budget and get something moving in the state. The governor only has the authority to, like I said, line item veto. And then hopefully after our August 6th primary, the legislature will return, in September after the fiscal year starts. And then they will continue some legislative work here and there until that general election in November and through the end of the year. So that is our budget process. I would absolutely recommend, I see Courtney put some links in the chat as well. I recommend taking a closer look at this. timeline, familiarize yourself with it, and then also take a look at some of the documents provided, to accompany this presentation. Gives you more details if you want to geek out on some numbers and data. Gives you some good details on where state tax dollars go, how that breakdown occurs, and really what it looks like. So, I gave a pretty long and detailed overview of the budget, but I'll get into some specifics here that matter to all of you and to the ARC. So this year for fiscal year 24, what we saw was we had the governor recommend a historic $81 billion in spending. So that was back in February. And then the House came in at $61 million above the executive recommendation. And then the Senate came in at recommendations $8 million under the executive recommendation. So, we have some differing in priorities here between the House and the Senate. But generally they stayed in that ballpark of, $81 billion. So again, Courtney did link the budget poster in the chat. That is where you can see the breakdown of how our dollars are spent in the state. That'll give you some more details on, where does your motor fuel tax go towards, where does our cannabis tax go towards? So that will break down everything for you in more detail. So, looking at this upcoming fiscal year and what we are prioritizing as the ARC, first one and always our biggest priority is the direct care worker wage. The executive recommended a continuation of the 85-cent increase per hour that was issued last fiscal year. And that is in addition to the $235 that was appropriated in fiscal year 23. So, we really aren't going to see what they proposed was not an increase to what our direct care workers and direct service professionals have been getting since October 1 of last year. They are proposing to continue that funding. And the House and Senate also concurred with the executive and agreed that the state should continue to fund that 85-cent increase on top of the $235. So this is something we're still actively working on. Like I said, we haven't wrapped up the budgets yet. We're hoping to do so before July 1. So hopefully next week we'll have some more answers on what that specific piece looks like. Seeing what our revenues look like this year, we aren't flush with cash like we were when we were getting federal COVID relief dollars in the state, increased tax dollars from spending. I would expect that we do see this continuation of the 85 cents per hour. And then, whether or not we see any boilerplate changes to the bill. So that is specific language detailing how those dollars are spent. I think that is to be foreseen right now. But we are hoping to have updates for all of you here in the coming week or so. Other items we watch are Medicaid spending. So in the executive and the House and Senate budgets, we saw an increase in spending for mental health services, substance use disorder services, and then our CCBHC funding. For our special education funding or, funding for those with a disability receiving education in our public school system, we have additional increases to per pupil funding this year. The House and the Senate recommendations did differ a little bit. We have two teachers who are very passionate about funding our schools and finding a way to get rid of the debt that schools have across the state. And so this piece will really be something that we're closely watching. And it's really, like I said, to be foreseen as education is a hot topic right now in the state. Some other things we're watching, foster care education navigation. So this is a program that the ARC is involved in. It's getting foster care children, especially those who have a disability or suspected disability, proper education, and then navigating that educational environment, especially if they are mobile students across the state. So the governor's recommendations did not include funding for this program. We did see that the House included $1 million to continue funding this program ongoing for future years. And so we have been advocating to get this in our final budget that we hope to see passed next week. So we'll definitely be keeping an eye out for that program as well. And then finally, voting access. This is a legislative priority for our Democrats, but we have been hearing that there is potentially money to improve our polling place locations, making them more accessible, making it easier for individuals to navigate. And so this is a piece a lot of the advocates are very excited about seeing. And so again, we will see what happens this next week. But having our state departments on board with funding that piece is crucial. So I think we're looking forward to seeing some funding there. All right. Now that I kind of gave you an overview of our state budget and what we're looking at right now, I'll now dive into our advocacy issues. So like I mentioned earlier in the beginning, advocacy is not only with our legislators on the legislative side, it also takes place on the regulatory side of things. So we have a number of items that we are closely watching in the state. First is conflict-free access and planning. So there was, CMS guidance issued that called for organizations to carry out access to person-centered planning, case management supports, and other functions of our public mental health system. And it requires them to be separate organizations from the provider that gives mental health services. And so what we are seeing right now is the department working through what that conflict-free process looks like. And so we don't have final answers on what this looks like exactly, but it is a regulatory issue that we are following and hope that we get to share with all of you as the department continues to work through that item. Another regulatory issue that we're following is electronic visit verification. So this is how providers will be recording and billing their hours, served caring for an individual. So this is expected to start September 3rd for our My Choice Home Help individual caregivers, My Health Link and our managed care home healthcare services. And then we are, looking specifically at how these individuals, will be listed in this policy, what their requirements are for, recording how much time they're spent. There was concerns originally that EVV would require recording every 15 minutes for providers for when they're with someone. So we actually saw that in the recent guidance issued, beneficiaries with home help and CLS services or congregate residential settings where 24-hour services available and living caregivers are currently exempt from EVV, just based on the fact that they're with that individual or individuals all day and taking 15 minutes. Every 15 minutes, you're probably taking 15 minutes to record what you did during that time period. And so we're continuing to watch EVV, ensuring that there isn't additional burden on our direct support professionals, our home help staff, our living caregivers, and making sure that, this fits well with what has been working in the state. And then finally, the last thing that we are watching closely is the transition from My Health Link to our highly integrated dual eligible special needs plan. So this was recently released by the department. And so this also, following CMS, transitions My Health Link into a more permanent structure with our highly integrated dual eligible special needs plan. What we are watching for here is whether that highly integrated plan will turn into a fully integrated plan. So right now, the highly integrated plan, covers either long-term care services and supports or behavioral health. The fully integrated would kind of link everything together. So this is something that the ARC is watching closely. Should we have updates as policies developed, we'll absolutely keep you all updated. These are big regulatory items that we are working on with our department at this time. All right, so those are our big regulatory pieces. Now our legislative pieces. So if you go back to that state budget timeline that I gave you, our state budget operates in different sections, clearly based on those different colors. Our legislative issues don't operate the same way. So we don't always have a clear timeline of when bills will move like we do the state budget. Every year, it's a really easy process for someone who's been in the weeds on the budget. You know exactly when things are going to happen. You can easily make predictions on what's going to happen. Advocacy issues are a little bit different. And so for those of you that subscribe to the government affairs reports or are on different, listservs with the ARC or other advocacy organizations, you may get those action alerts that pop up. Contact your legislator today. That is because things can happen overnight in Lansing. We've seen a lot of policy issues, big policy issues, quite literally happen overnight in Lansing. And so this is always something that, my job is to stay on top of and keep you all updated on the biggest issue happening, this next week, tomorrow. And so looking at some of our key legislative issues for the ARC, what we've seen signed into law. So since last year, since we last spoke, we had legislation to address hate crimes in the state, which includes individuals with a disability or behavioral health issue. We have legislation to protect vulnerable adults in the state. So we recently had a very amazing and big disability advocate in our state legislature, Representative Sharon McDonnell. She has been a sponsor of this legislation and a number of other pieces in this space. This is to protect vulnerable adults from providing sexually explicit material and being taken advantage of in that space. And so this was a big win for a lot of our advocacy groups. And then we also saw a handful of insurance bills signed into law. So one is the Affordable Care Act codification. For those of you that have been following federal conversations, this was a big piece last year in 2023, especially out of Texas. A Texas court ruled that the ACA, didn't have standing, more or less. I won't get into the details on that. And they actually reversed some of the Affordable Care Act provisions in their state. And so in the event that a federal court would, or a Supreme Court, would take up the Affordable Care Act, our legislators worked to pass a handful of bills that would keep the Affordable Care Act in our state statute instead of just being the overarching federal guidance. And so we saw those bills signed into law last year. There are a couple more lingering out there that may get done this year. And so we continue to watch those. And then some other bills that just recently were signed by the governor have to do with telemedicine. So ensuring that our Medicaid health plans and our state insurers are providing telemedicine to patients when appropriate, and if it's requested, and then to ensure that our providers are getting billed correctly, for providing telemedicine services as they would if they were seeing the individual in person. So looking at what we are currently tracking, so these are items that are in the early stages or late stages of the legislative process. Reminder that our legislative process, the way a bill moves is that it gets introduced in the House, the Senate. It has to go through a committee hearing or two. It has to get passed on the House or Senate floor, and then it will go to the opposite chamber to do the same thing. And then once that second chamber passes the bill, it'll go to the governor's desk for his or her signature. So some of these are nearing that final process of getting to the governor's desk. One of them is our guardianship and conservatorship package. So these are House Bills 4909 through 4912. There's also recently an addition of a financial bill that was introduced in the Senate. But these House bills are in the Senate right now. They are nearing that final step to get to the governor's desk. But this creates changes to EPIC. So this does not address our mental health code. It is only EPIC side of things. So just wanted to make that clarification for all of you here. Another bill package, these are Senate Bills 790 and 791. This would allow for home health workers to unionize. So this is not our larger direct care workers. This is just our home help group. The home help community used to be unionized, and then I believe under Governor Snyder that was overturned. And so we are now facing two bills that would unionize that community again, to argue for fair wages, hours, all the things that come with a union. These bills have only been introduced. They have not seen any next steps in the legislative process. So it is something we're watching to see when that does come about. Another piece of legislation we're looking at is school safety. So most notably House Bill 5549. This is legislation that would create a school safety commission in each school district. Obviously, there are concerns with this, especially for individuals in the disability community. We would never want an individual with a disability or suspected disability, including mental health or behavioral health, to be put in a situation where they are expelled or the police get involved for something that they may not be conscious that they are doing, or in control of necessarily. And so we have been working with the bill sponsor of this package to make sure that we are protecting those students, ensuring that there are other safeguards put in place to avoid, that police contact and make sure that they're getting connected with their, if they have, any home help or direct support professionals or mental health professionals they work with, there's a connection there. And also just ensuring that we have professionals on this group who are educated in identifying someone who may have a disability or understanding what their plan is if they do have a disability. So this bill is still in the House. It has not gone to the Senate yet, so we're still in early stages of the legislative process. And then finally, we have a voting rights and access package moving right now. It is Senate Bills 401 through 404. And this legislation would make a handful of changes. It would codify Voting Rights Act into our state statute and state law. But it would also allow for, most notably, individuals who have a disability or who require additional help voting, allow that to be more accessible and easier for that individual to do so, while also protecting the individual, from any bad actors in the space. So these are all legislative issues we are working towards. We're continuing to follow. And we will see what happens this year. A lot of what gets done the remainder of 2024 is based on what happens with our election this fall. So after the election in November, we have this period called lame duck. What that means is that it is the period after the election cycle. And so if we have Democrats, they win the House again, status quo remains in Lansing. It may be very quiet in November and December. However, if the Democrats lose their elections and lose majority going into 2025, we could see a very busy lame duck period where they are trying to pass final bills before, they would lose that majority and that leadership going into the new legislative session. So some of these may be reintroduced next year, some may get done this year, but definitely keep an eye out for those government affairs reports, where I provide those updates and you can stay in the loop. Before I move on, I see Sarah has a question. So House Bill 790 and 791 is not for direct care workers. It is just for those who are specifically home help. All right. I'm wrapping up my presentation here. So I am going to share with all of you how to be an effective advocate. And then obviously, if you have any questions, feel free to drop those in the chat as I move through. But I want to give you all the tools that you need to feel like to empower you to come to Lansing or to stay in your district and speak with your legislator. All right, so what is advocacy? Advocacy is supporting a cause or an issue in an effort to educate lawmakers and then build support around that issue. The key word there is educate. That is what all of you can do to be an advocate. As a lobbyist myself, I am able to have more frank conversations. I'm able to ask legislators to vote yes or no on a package. And if you are not a registered lobbyist, there is kind of a little fine line you have to dance around. And so advocacy is focused around educating your lawmakers. You want to give your lawmaker all the tools they need to make the best decision when it comes to voting on a bill, or it comes to having conversations on legislation or the budget. Advocacy involves developing public awareness. For those of you who get our awareness campaign emails on different bills that are moving, that is a huge part of education. And then advocacy does not always involve lobbying. So as I mentioned, lobbying is direct contact with an elected official in order to influence them. And there are times when lobbying also involves money. So in the case of the ARC as a nonprofit organization, money from or any other nonprofit organization that you might work at, money from that organization's fund cannot go towards lobbying activities. So just keep that in mind as you look at advocating for any issues or in your community. Your goal is to educate. You want to make your lawmaker the expert on the topic that you're an expert in. So why should you engage in advocacy? Most legislators are not healthcare experts or well-versed in the IDD space. To Sarah's comment, so what about when people with lived experience meet with legislators? If you have lived experience, you are the best advocate to talk about a certain bill, to talk about legislation moving. And when I say that, you can still mention legislation. You can ask them to support a specific topic, a specific bill, It's that influence piece that gets you into the lobbying space. So when you're meeting with legislators, especially if you have lived experience, being the advocate, telling your story, speaking on behalf of yourself and your experience, or a family member or friend's experience, that is really that key difference there. But you likely know more than they do. I mentioned one of our representatives, Representative Sharon McDonald out of Troy. She is a fabulous advocate. She has lived experience. She understands this space so well. And so you need to find those legislators who do not have that same kind of experience, and you need to help educate them and make sure that they're fully understanding every aspect of why a certain bill would change the law to either benefit or hinder the IDD community. You're an advocate every day in your work, with your family, with your friends, and then you have a unique and critical perspective. Especially with lived experience, your stories are imperative to ensuring that legislators understand, who their constituents are, what their constituents' daily life is like. So when advocating, always keep in mind you want to cast a wide net. I covered a lot of different topics today, but what I want you to recognize is that we don't just talk to our legislators, we communicate with our governor's office. And then we don't just talk to our, legislative side and our executive side, we also talk to our regulatory side, our departments in the state. So MDHHS, MDE, you always want to make sure that you are, covering the water and who you're advocating to. And that even includes our departments. And then just keep a reminder that with our legislative body, you want to keep it bipartisan. So speaking to both Republicans and Democrats, and then keeping it bicameral. So speaking to your House members and your Senate members. This space, the IDD space and working legislation, is very special because I like to think it doesn't get political. Obviously, politics happen. Things do get political for different reasons, but access to healthcare and supporting our community with an individual who has a disability, physical or behaviorally, that should not be a partisan issue. And so always focus on reaching across the aisle. You may lean one way or the other, but always make sure you're talking to that person that's on the other side of the party line. That is the most important thing, is to meet people who have different opinions than you and just educate them, tell them your story. So some strategies and tactics when being an advocate: be proactive, get ahead of the game. Like I said, things happen overnight in Lansing. And so, once we see bills introduced, I try to get in front of that legislator, try to talk with the ARC, other advocates, figure out where we stand on the issue. If we have issues, we're going to be issues with the legislation, we're going to be proactive. We're going to get out there before it's even scheduled for a hearing, because we want to work on the bill. We want legislators to know, who the experts are at the table. But again, because things do happen overnight, you do have to be reactive. So understanding the political climate, what's going on, that's definitely a part of my role. Understanding what's currently happening in Lansing and how that may have effects on legislation moving. Be strategic and properly timed. And then additionally, build brand and familiarity first. A lot of legislators know who the ARC is. I hope all of them do at this point, especially our new ones. But as an individual advocate, you can build your own brand and familiarity with your legislators. And that's really important. So they know who to go to when they have a subject matter, that might relate to an area that you can be an expert in. They want to know who the familiar face is in the room. So building the foundation of your advocacy and of your asks, like I mentioned, relationship building, that's key. Your legislators want to know who to call when they have a question pop up. They can say, I know this person and they have lived experience, and I'm going to ask their opinion on this bill. That's what we want to see, and that's how we build advocates in the community. So it's as easy as going to your legislators' coffee hour, whether it's virtual or in person, helping them with their campaign, calling their office, going to events. That will build familiarity and they'll recognize you. Always have a clear message. So when you are going in to advocate for a specific item, make sure you've rehearsed a little bit what you want to say. What is your stance on the issue? What's your opinion? Making sure it's very clear for them to follow. Regularly, when I go into meetings, especially with advocates, I bring a one-pager. Having a single piece of paper, one page with bill number, the issue, why you support it, why you oppose it. that's what a legislator wants to see. They really want to get the 5,000-foot view of what it is, and that is a part of having a clear message. Again, appropriate timing in the year, legislative session. That is a role that I can help fill for anyone. So keep an eye out for those government affairs reports, and then obviously actionable emails that may come from anyone. And then stay consistent in messaging, especially if it's a bill the ARC is working on. We will likely have a stance on the issue. And so we'd ask our advocates, if you're going out in the community, you're going to meet with your legislator, you stay on message and you stay consistent with what your ask is. So if you have the chance to come to Lansing and meet with your legislator, however, this also applies to meeting in your district, be prepared, research your lawmaker. Where are they from originally? What's their background? Maybe find a connection. Do they have, education experience similar to you? They have family in your area. Find something that you can relate to them on. And then also understand their issues. Like I mentioned earlier, a lot of our legislators are not well versed and do not have experience in this space. So maybe find an issue or understand what issues they do work on. It might not be in the IDD space, but that would then be your goal to make sure that they are educated and they do understand a little bit more about it. And then always reflect on what your position is. Again, if the ARC is asking for advocates, understand what the position is of the organization and then bring that to the table at your meeting. And then what's your story? Again, having lived experience, that is the best story to tell. Legislators want to personally know their constituents. And so knowing your story, having that story, laid out clearly for your legislator, that is key for being an effective advocate. And then again, always be flexible, especially in Lansing. Schedules change at the drop of a dime. So be flexible, understand that your meeting may get moved. It may be 15 minutes instead of 30 minutes. Always be prepared to change on a whim if necessary. Punctuality and brevity. Again, go back to that one pager. If you can keep it simple and concise and get to the point, that will be the most beneficial for the legislator to understand. And then they can take time outside of your meeting to further educate themselves. Never be discouraged if you're meeting with staff. Staff are the ones that don't have term limits. So they're here for more than 12 years. We have some staff members who have been here, for 30 years and have seen all of the changes in the behavioral health field, move through the legislature and through the state. And so they have the institutional knowledge in the background that a legislator may not. Make personal connections. Like I said, research your lawmaker, learn a little bit more about them, see where you can connect on something. And then finally, stay on message. After your meeting, if you can, write a handwritten note. That definitely goes a long way. If not, you can feel free to send the office an email, thanking staff if you see them or the legislator in public. All of those things continues to build that familiarity with your name and with your face. Send any documents or background that was promised. So if you say, I'd love to share more information with you after a meeting, make sure you're following up with that. And then again, establish consistency and continuity. So continue reaching out, even if it's just a, hey, how are you? How is the campaign going? Finding a way to connect with your legislator is a great way to continue to build your brand and your familiarity with them. Sarah, your question, what does brevity mean? Brevity is keeping it concise and brief. So legislators, especially if it's a new topic, sometimes it can be very overwhelming if they're hearing new terms for the first time or understanding a new topic. And so keeping it as concise and clear as possible, that is what I mean when I say brevity. All right, well, that is the end of my presentation here. I do have some resources linked in this presentation that will be available online. Again, Courtney did send some documents in the chat that will also be posted online. But I am happy to answer any questions. I know we are coming down here with about 5 minutes left, but I would love to hear if anyone has anything for me.
I'm not seeing anything in the chat. But we have a moment to let people type. We just posted the link to where all the handouts and recordings are going to be available for folks after this presentation.
If anyone does have any questions you think about after the fact, feel free to email myself. My email is on the screen. Or, I'm sure you could reach out to Sherry as well, and she can pass any notes along to me. So I really appreciate being here, being able to give this presentation to you all. It's always a pleasure. So yeah, thank you so much.
Thank you, Emily. Thank you, everybody, for joining us. And if you're not signed up for those ARC Michigan newsletters, it's a great way to keep up to date with these advocacy efforts. So thank you, everybody, and have a great rest of your day.